I'm Mrs. Radha Gopal. I'm 83 years old and I've been suffering from knee problem for the last 6-7 years. And I was advised knee replacement surgery, and initially I was very apprehensive and didn't want to go through. But after suffering for 2-3 years, I found life was becoming very, very difficult. So I thought I should go for it. Meanwhile, my nephew, who himself is an orthopedic surgeon in Chennai, Dr. Sri Kumar Raghavan, suggested I better go for a knee replacement. Then initially I was not agreeable. Then I decided, after seeing all this pain and all that, when I went through, I decided I'll go for it. But since I stay in Bangalore, I thought I will get the surgery done in Bangalore. And also, normally relatives, they don't do it for their own relations. And my nephew didn't want to do the surgery. So then I started scouting for a very good doctor who can do the knee replacement for me. And from many sources, I got the name of Dr. Rajasekhar KT for my knee surgery. Then I decided I'll go for the surgery.
A lot of people have fear about knee replacement surgery, about so many aspects of the knee replacement surgery, like pain, survival. There are a lot of people who have fear that whether I will survive after knee replacement surgery or not. That is because of infection and embolism and pain. And there is other last one is that there is a knee bending and pain. So these are the factors which makes them scared about knee replacement surgery. What we are doing in fast track knee replacement surgery is that patient will be walked within 6 hours after surgery, so that it gives a confidence to the patient, and it will prevent the blood clot occurs in the legs and prevent the embolism formation. We also use blood thinners, and also fast for within 6 hours of mobilization, it prevents the blood clot formation and fear. So second thing is that we also prevent sending the patient to ICU, where we know ICU is another fear for the patient. The fear is, in a sense, in ICU, the atmosphere is very unknown people, and a lot of machineries are there, especially these ventilators. These beeps makes people scared about these things, and a lot of tubes are put, and the patient attachment to the nurses, to the doctor, patients are to the staff will be very less. Unlike the patient is coming and sitting in a ward where the relatives are next to them, and a known team of doctors are coming and meeting them, it makes them very comfortable. So with this, so the one is the faster mobilization and less pain or no pain. Within 6 hours of walking, we can, and there is no ICU. And some people we don't use it, urinary catheter, and with the patient will be discharged within 4 to 5 days after one knee replacement. If they are doing both, maybe 7 to 8 days. So this is about the fast track knee replacement surgery. These are the examples of the patients. I can give n number of examples. I operated from up to 85 years of age, up to 90 years of age. They have all mobilized within 6 hours of surgery, and I operated up to 130 kg weights, and they are also mobilized within 6 hours for surgery, and they discharged without any problems, and they are walking very comfortably without any issues. So this is about the fast track knee replacement surgery.
You won't believe, it has been just a miracle. In 4 days, I find my knee pain has completely gone. I'm able to walk around in the corridor, and the doctor himself was so much impressed. Whoever is having this type of problem should come to him. Really, he is a godsend for me. So, and one more advice which I would give for people suffering from this is, you go through a physiotherapy which teaches you to build up your muscles and which helps you in recovering very fast when you get this surgery done. Dr. Rajasekhar KT, I thank you sincerely from my heart for giving me this life and also the hospital, which has been so cooperative and so well doing in all this thing. Thank you.